So in people that have prediabetes, there's usually two things that happen in the body that is driving the blood sugar to be higher than it should be, and that is insulin resistance and beta cell burnout. I will explain that what these two mean with a couple fun pictures. So over here, you can see how your body actually processes food. And it pretty much starts with insulin, which you have probably heard about before. Well, this is a hormone that is made by the pancreas when you eat something so that the blood sugar concentration can be managed. So pretty much your pancreas is going to make this insulin, and you want to think about insulin like the key that is going to open the door so that the blood glucose or blood sugar from the foods that you consume is going to enter the red blood cell, all kinds of cells in your body, so that it can be burnt for fuel. So this is a natural process in your body, and the whole goal is for this to be running smoothly so that blood sugar can be utilized the way it should and not be stored as fat, or so that the blood sugar is not ongoing being present in the bloodstream, which is also not something that we want. So let's talk about what happens with insulin resistance. Insulin resistance, it's a condition when your pancreas is making enough insulin, but the body doesn't use it effectively. So pretty much the key just can't open the door. So what happens? The blood glucose builds in the bloodstream over time, and this can be very taxing for several organs, in addition to just this being reflecting in your A1C level. The whole goal is for that glucose to be transported inside the cell, because like we said, that is where it will be used by the body, and in the bloodstream doesn't really help a whole lot. It needs to be in the cell so that it's burned. So there's a couple factors that actually plays this scenario. So being overweight makes these cells kind of be squished together, and they leave no room for the key, which is insulin, to open the door. Other individuals could be consuming foods that require a whole lot of insulin, so it's just not going to be very conducive for a smooth process. Now, what I see in other people is that their pancreas, like this guy, gets tired and burned out, such as the same way you get burned out when you go to work and you have all these demands, and you're being asked to be doing, X, Y, and Z 24/7. At some point you can't keep up. So this can actually happen to your pancreas as well. So how does this happen? Well, it happens as we age, and of course we can't control that, right? But it also happens because of eating unhealthy very frequently, or eating or drinking specific foods that require more insulin. So you can see over here how, your cell from the pancreas is actually losing the amount of insulin that it can make over time. So you may be asking yourself, now that I have been told that I have high blood sugar levels because I am pre-diabetic, as here, why could that high sugar could be impacting in terms of other blood work?